Hello everyone, this is Dr. Simone Atkinson once again with another video to help you prepare for the NCLEX. This video I want you to test yourself now on maternity information. So this video includes questions and answers again on maternity, just about 100 facts or so that you should know in order to help you succeed in answering the NCLEX questions once you start practicing them. So let's get started.
What is HELLP related to pregnancy? HELP syndrome stands for hemolysis, H, elevated liver enzymes, EL, and low platelets, LP. It is a severe complication of preeclampsia and can present with symptoms like right upper quadrant pain, nausea and vomiting, and malaise. What is oxytocin used for? Oxytocin is used for the induction or augmentation of labor. It should be administered via an electronic infusion pump and requires frequent monitoring of both the mother and the fetus. Adverse effects may include maternal hypertension and water intoxication. What are torch infections, and how do they affect pregnant women? Torch infections are a group of infections, toxoplasmosis, other parvo B19, rubella, cytomegalovirus, herpes, that can cause fetal abnormalities in pregnant women when the infection is contracted during pregnancy. What are the components of the TORCH acronym? The TORCH acronym represents T for toxoplasmosis, O for other infections, like parvovirus B19 and varicella zoster, R for rubella, C for cytomegalovirus, and H for herpes. These are infections that can affect the developing fetus during pregnancy. What puts a patient at risk for preterm labor? Infections, such as periodontal disease, can increase the risk of preterm labor. How much blood loss is considered postpartum hemorrhage, PPH? Postpartum hemorrhage is defined as blood loss exceeding 500 milliliters after a vaginal birth or more than 1,000 milliliters after a cesarean section, C-section. What is uterine atony, and how does it relate to postpartum hemorrhage? Uterine atony is a condition where the uterus is poorly contracted, appearing soft and boggy. It is the most common cause of early postpartum hemorrhage and leads to excessive bleeding after childbirth. What typically causes delayed postpartum hemorrhage, PPH? Delayed PPH is often caused by retained placental fragments within the uterus that were not expelled following childbirth. What are some risk factors for postpartum hemorrhage, PPH? Risk factors for PPH include a history of previous PPH, uterine distension, uterine fatigue, high parity, having many pregnancies, and certain medications used during labor and delivery. What does foul-smelling lochia suggest? Foul-smelling lochia may indicate an endometrial infection. What are some other signs of endometrial infection? Signs of endometrial infection may include maternal fever, tachycardia, rapid heart rate, and uterine pain or tenderness. What is the expected range of white blood cell, WBC, count in the first 24 hours postpartum? In the first 24 hours postpartum, the WBC count may be elevated, reaching up to 30,000. An elevated temperature is also common. How much folic acid do pregnant women need daily? Pregnant women need a minimum of 400 micrograms of folic acid daily. What foods are good sources of folic acid? Folic acid can be found in green leafy vegetables, beans, rice, peanut butter, and fortified cereals. When can opioid agonist-antagonist medications be used during labor? Opioid agonist-antagonist medications can be used during the active phase of stage 1 labor, when labor contractions are well established, and the cervix is dilated to at least 4 centimeters. Why are women in a hypercoagulable state during pregnancy? Women are in a hypercoagulable state during pregnancy to protect them from excessive bleeding, but this state also increases the risk of deep vein thrombosis, DVT. Early ambulation is essential after childbirth to mitigate this risk. What is the normal fetal heart rate range? The normal fetal heart rate typically falls in the range of 110 to 160 beats per minute. Under what circumstances should a vaginal exam not be performed for a pregnant woman? A vaginal exam should not be performed if there is unexplained vaginal bleeding. What is suspected in a pregnant woman experiencing painless vaginal bleeding after 20 weeks gestation? Painless vaginal bleeding after 20 weeks gestation may suggest placenta previa, a condition in which the placenta partially or completely covers the cervix. What is the purpose of taking folic acid during pregnancy? Taking folic acid during pregnancy helps prevent neural tube defects and spina bifida in the developing fetus. What is an amniotomy? An amniotomy is the artificial rupture of the membranes of the amniotic sac during labor. What should the nurse do during an amniotomy procedure? During an amniotomy, the nurse should assess the fetal heart rate, FHR, before and after the procedure, observe the characteristics of the amniotic fluid, and assist the client in adopting an upright position after the procedure. What is the Bishop score used for? The Bishop score is used to assess and rate cervical favorability and readiness for the induction of labor. A score above 8 is considered favorable for labor induction. What does X-linked recessive mean in genetics? X-linked recessive refers to a genetic inheritance pattern where the gene responsible for the condition is carried on the X chromosome. It primarily affects males who have only one X chromosome and do not have a corresponding X chromosome to compensate for the mutated gene. Hence, it is carried by females and affects males. What is preeclampsia? Preeclampsia is characterized by new onset hypertension, BP 140/90, combined with proteinuria, greater than 300 mg of protein in the urine in 24 hours, after 20 weeks of gestation. What are the signs of preeclampsia? Signs of preeclampsia include elevated blood pressure, 140/90 mmHg, significant proteinuria, greater than 300 mg of protein in the urine in 24 hours, headache, visual changes, and 2+ pitting edema. What severe problem can preeclampsia lead to? Preeclampsia can lead to seizures, indicating the development of eclampsia. What is placental abruption? Placental abruption is the premature detachment of the placenta from the uterine wall before childbirth. What are the priorities of care for suspected placental abruption? The priorities of care for suspected placental abruption include monitoring the mother's fluid status and assessing fetal heart tones, as placental abruption can lead to maternal hemorrhage and fetal oxygen supply interruption. What are some symptoms of placental abruption? Symptoms of placental abruption may include frequent contractions, abdominal pain, and dark red vaginal bleeding. What is placenta previa? Placenta previa is a condition in which the placenta covers the opening of the mother's uterus, often presenting with painless vaginal bleeding. What is the normal, expected deep tendon reflex, DTR? The normal, expected DTR is 2+. What might the presence of neurological changes in pregnant women indicate? Neurological changes in pregnant women may indicate worsening preeclampsia. What do torch infections cause? Torch infections can cause fetal abnormalities in pregnant women. What does TORCH stand for? TORCH stands for toxoplasmosis, other, parvovirus, varicella zoster, rubella, cytomegalovirus, and herpes simplex virus. These infections can affect the developing fetus. What do late or variable decelerations indicate in pregnancy? Late or variable decelerations in fetal heart rate monitoring can indicate fetal distress and may necessitate intervention. What does the acronym HELLP stand for in pregnancy? HELP stands for hemolysis, elevated liver enzymes, low platelets. This condition is associated with severe preeclampsia and often requires immediate delivery. Swelling of the hands, feet, and face are expected findings in which pregnant condition? Swelling of the hands, feet, and face is an expected finding in preeclampsia. What are the two main symptoms of preeclampsia? The two main symptoms of preeclampsia are high blood pressure and the presence of protein in the urine. Edema is common but not part of the diagnostic criteria. What complications can arise from preeclampsia? Complications of preeclampsia can include eclampsia, placental abruption, and the HELLP syndrome. What are some symptoms suggesting a pregnant woman may have the HELLP syndrome? Symptoms of the HELLP syndrome may include right upper quadrant, RUQ, pain, nausea, vomiting, and malaise. What can a woman be susceptible to once her water breaks during pregnancy? Once a woman's water breaks, she becomes susceptible to infection. If a pregnant woman's group B streptococcus, GBS, status is unknown, what should be done? If a pregnant woman's GBS status is unknown, she should be given prophylactic antibiotics during labor to prevent potential transmission of GBS to her newborn, which can lead to conditions like pneumonia or neonatal GBS sepsis. When are pregnant clients typically tested for Group B streptococcus, GBS? Pregnant clients are typically tested for GBS between 35 to 37 weeks of gestation. What happens if a pregnant woman is found to be GBS positive? If a pregnant woman tests positive for Group B streptococcus, GBS, she receives prophylactic antibiotics during labor to protect her newborn from potential GBS-related complications. What is isotretinoin commonly known as? Isotretinoin is commonly known as Accutane and is used as a medication for acne. What is the relationship between Accutane, isotretinoin, and pregnancy? Accutane should not be taken by pregnant women or those planning to become pregnant, as it can cause serious birth defects. It is classified as pregnancy category X. What are the requirements for females prescribed Accutane? Females prescribed Accutane must have 2 negative pregnancy tests before starting the medication and must use 2 forms of contraception to prevent pregnancy while on the drug. Describe the normal symptoms of labor. Normal symptoms of labor include intermittent pain with contractions and the presence of a small amount of blood-tinged mucus, often referred to as the bloody show. Describe the symptoms of placental abruption. Symptoms of placental abruption typically include sudden onset vaginal bleeding, abdominal pain, and frequent uterine contractions. Describe the symptoms of placenta previa. Symptoms of placenta previa typically include painless vaginal bleeding and an ultrasound that shows the placenta covering the cervical os. MMR is a live vaccine, and live vaccines are contraindicated during what? Live vaccines like MMR are contraindicated during pregnancy and active infections. What are some examples of live vaccines? Examples of live vaccines include MMR, measles, mumps, and rubella, and varicella, chickenpox, vaccines. When is the best time to give the MMR vaccine to a non-immune compromised pregnant client? The best time to give the MMR vaccine to a non-immune compromised pregnant client is immediately postpartum. When can fetal sex be determined? Fetal sex can typically be determined by the end of 12 weeks of pregnancy during an ultrasound. How long should an acceleration last on a fetal heart strip, and what does it indicate? An acceleration on a fetal heart strip should last for at least 15 seconds and involve an increase of 15 beats or more above the baseline, indicating fetal movement. Is moderate variability of a fetal monitor strip considered normal? Yes, moderate variability, 6 to 25 beats per minute, in a fetal monitor strip is considered normal and healthy. What do late or variable decelerations in fetal heart monitoring indicate? Late or variable decelerations in fetal heart monitoring indicate inadequate fetal oxygenation and can be concerning. If a patient on oxytocin for induced labor experiences more than 5 contractions in 10 minutes, what should the nurse do? If a patient on oxytocin for induced labor experiences more than 5 contractions in 10 minutes, the nurse should stop the infusion. If a patient on oxytocin experiences late decelerations, fetal bradycardia, tachycardia, and decreased variability, what should the nurse do in order? In the presence of concerning signs such as late decelerations, fetal bradycardia, tachycardia, and decreased variability, the nurse should take the following steps: stop the oxytocin infusion immediately, position the client on her side, administer oxygen, 10 liters via face mask, provide an intravenous fluid bolus, consider giving terbutaline, notify the healthcare provider, and document the events. What causes heartburn in pregnancy? Heartburn in pregnancy is often caused by the hormone progesterone, which relaxes the esophageal sphincter, allowing stomach acid to flow back into the esophagus. How can pregnant women avoid heartburn? Pregnant women can avoid heartburn by adopting certain strategies, such as maintaining an upright position after meals, consuming small frequent meals, keeping the head of the bed elevated, drinking smaller amounts of fluid while eating, and eliminating dietary triggers such as caffeine, chocolate, fried/fatty foods, spicy foods, and peppermint. Avoiding antacids like Alka-Seltzer is advisable during pregnancy. In pregnancy, when are patients considered anemic based on hemoglobin levels? In pregnancy, patients are considered anemic when their hemoglobin drops below less than 11 grams per deciliter. What is Naegele's rule? Naegele's rule is a method used to estimate a pregnant woman's due date. It involves adding 9 months and 7 days to the first day of the last menstrual period or subtracting 3 months and adding 7 days. Conception typically occurs around the time of ovulation, which is about 14 days from the beginning of the LMP. In Arab culture, what is the rule regarding a man being alone with a woman other than his wife? In Arab culture, it is typically not allowed for a man to be alone with a woman other than his wife, following principles of modesty and propriety. What medication is given for preeclampsia? Magnesium sulfate is given to prevent seizures in patients with preeclampsia. What drug is kept at the bedside when administering magnesium sulfate, in case of magnesium toxicity? Calcium gluconate is kept at the bedside to counteract magnesium toxicity in patients receiving magnesium sulfate. In the context of seizure precautions for a pregnant woman, what position should the nurse place her in? When taking seizure precautions for a pregnant woman, the nurse should place the client in the left side lying position to enhance maternal and fetal circulation. How is oxytocin typically delivered to a client, and what nursing considerations/actions should be taken? Oxytocin is typically delivered through an infusion pump into a proximal port, not distal, in the intravenous line. Nursing considerations and actions include monitoring fetal heart rate and uterine contraction patterns at least every 15 minutes, continuous FHR monitoring, and monitoring intake and output. Why is oxytocin administered via an infusion pump, and what should be monitored during oxytocin administration? Oxytocin is administered via an infusion pump to avoid medication errors. During oxytocin administration, monitoring for uterine tachysystole, decreased placental perfusion, fetal distress, and water intoxication is essential. Why is monitoring intake and output important during oxytocin infusion? Monitoring intake and output is important during oxytocin infusion because excessive water intake can lead to water intoxication due to the antidiuretic effect of oxytocin. After 20 weeks of pregnancy, how does fundal height measurement correlate with the number of weeks of gestation? Fundal height measurement correlates with the number of weeks of gestation, with the fundal height, measured in centimeters, usually approximating the number of weeks of gestation. For example, if a pregnant woman is 24 weeks pregnant, her fundal height should be approximately 24 centimeters above the pubic symphysis. What is quickening in pregnancy? Quickening is the term used to describe the awareness of fetal movement by a pregnant woman. Quickening is typically felt around 18-20 weeks of gestation for first-time pregnancies and may be felt sooner by women who have been pregnant before. First trimester in weeks? The first trimester typically spans from 1 to 12 weeks of pregnancy. Second trimester in weeks? The second trimester usually covers weeks 13 to 26 of pregnancy. Third trimester in weeks? The third trimester extends from 27 weeks to the end of the pregnancy. What is magnesium sulfate used for during pregnancy, and what is the therapeutic level? Magnesium sulfate is used during pregnancy to prevent or stop seizures, such as in cases of preeclampsia and eclampsia. The therapeutic level for magnesium sulfate is typically maintained between 4 to 7 milliequivalent/L. What organisms usually cause mastitis, and how can mastitis be prevented? Mastitis is commonly caused by Staphylococcus aureus. It can be prevented by promoting frequent breastfeeding and ensuring appropriate latching during breastfeeding. What should be done if a pregnant client has a prolapsed cord? If a pregnant client experiences a prolapsed cord, they should be placed in the knee-chest position, with their head down and buttocks up. This position helps relieve pressure on the cord. What modifications should be made when giving CPR to a pregnant patient? When performing CPR on a pregnant patient, place them on their left side and compress the chest slightly higher on the sternum to avoid excessive pressure on the uterus. Is it true that lying supine is not advisable for pregnant clients because it can compress the aorta and vena cava? Yes, it is true that lying supine is generally not recommended for pregnant clients because it can compress the aorta and vena cava, potentially leading to reduced blood flow to the fetus. True or false, pregnant or planning to become pregnant women should not take ACE inhibitors. True, pregnant or planning to become pregnant women should not take ACE inhibitors, angiotensin-converting enzyme inhibitors, due to the potential risk to the developing fetus. What are the two major purposes of amniotic fluid during pregnancy? The two major purposes of amniotic fluid are to prevent cord compression and promote lung development in the developing fetus. Where is amniotic fluid produced in the fetal body? Amniotic fluid is primarily produced by the fetal kidneys. What can cause oligohydramnios, and what is it characterized by? Oligohydramnios is characterized by an abnormally low volume of amniotic fluid surrounding the developing fetus during pregnancy. It can be caused by fetal kidney anomalies or the leaking of amniotic fluid through the vagina. True or false, oligohydramnios requires more personnel in the room for delivery. True, the presence of oligohydramnios, low amniotic fluid volume, may necessitate additional healthcare personnel in the delivery room. This condition may require medical interventions, such as amnioinfusion, the introduction of saline into the amniotic sac, or early delivery, and continuous fetal monitoring. What are the increased risks associated with oligohydramnios? Oligohydramnios increases the risk of umbilical cord compression and pulmonary hypoplasia, which can lead to breathing difficulties in the newborn. This condition warrants additional personnel and continuous fetal monitoring during labor and delivery. Where is the fundal height located at 12 weeks of pregnancy? At 12 weeks of pregnancy, the fundal height is typically just above the pubic symphysis. It gradually rises throughout pregnancy, reaching various landmarks as gestation progresses. Which types of heart medications cannot be given during pregnancy? Angiotensin II receptor blockers, ARBs, and angiotensin-converting enzyme, ACE, inhibitors should not be given during pregnancy as they can pose risks to the developing fetus. True or false, placenta previa is a condition where the placenta covers the cervix. True, placenta previa is a condition where the placenta is located near or covering the cervix, potentially obstructing the birth canal. True or false, an ultrasound is typically performed around 36 weeks of pregnancy to determine the location of the placenta. True, an ultrasound is often performed around 36 weeks of pregnancy to assess the location of the placenta and ensure it is not obstructing the cervix. True or false, if placenta previa is suspected, nothing should be inserted into the vagina. True, in cases of suspected placenta previa, healthcare providers should avoid inserting anything into the vagina to prevent potential trauma or bleeding. What is the life expectancy for individuals with trisomy 18 and trisomy 13, and what type of care is often provided? Individuals with trisomy 18 and trisomy 13 typically have a reduced life expectancy, often surviving only a few weeks after birth. In these cases, palliative and end-of-life care is provided to ensure comfort and quality of life. True or false, there is no cure or treatment for trisomy 18. True, there is no cure or specific treatment for trisomy 18, a chromosomal disorder. It is a genetic condition. What is an amniotomy, and what are the considerations when performing one? An amniotomy is the artificial rupture of the membranes to induce labor. Considerations include watching for cord prolapse, assessing fetal heart rate, and observing the characteristics of amniotic fluid. Once the membranes are ruptured, there is an increased risk of infection, so the patient's temperature should be checked every 2 hours after rupture. Is the supine position recommended for pregnant women? No, the supine position is not recommended for pregnant women because it can reduce uteroplacental blood flow and oxygen supply to the fetus. What number of weeks is considered term in pregnancy? In pregnancy, 37 weeks are considered full term. What does GTPAL stand for, and what does it indicate? TPAL stands for gravida, term, preterm, abortions, and living. It is a system used to assess a woman's obstetrical history. Gravida represents the number of times pregnant, term is the number of pregnancies carried to term, 37 weeks or later, preterm represents pregnancies delivered between 20 and 36 weeks, abortions are pregnancies ending before 20 weeks, and living indicates the number of currently living children. Why should healthcare providers assess the drugs a pregnant client has had in the last 4 hours during labor? This assessment is important because certain drugs taken by the mother may affect the newborn, potentially causing respiratory depression. What is gestational diabetes, and when does it typically occur? Gestational diabetes is the onset of elevated blood sugar levels at 20 weeks of pregnancy or later, without the presence of proteinuria. How many centimeters of cervical dilation are required for giving birth? A woman typically needs to be fully dilated to 10 centimeters to give birth. Does the recommended weight gain during pregnancy vary based on pre-pregnancy BMI? Yes, the recommended weight gain during pregnancy varies based on a woman's pre-pregnancy BMI. Women who are obese may be advised to gain less weight during pregnancy, while underweight women may be advised to gain more. How much weight gain is recommended for all pregnant clients during the first trimester? For all pregnant clients, a recommended weight gain of about 1.1 to 4 pounds is suggested during the first trimester. How much weight should a pregnant client with a normal pre-pregnancy weight gain during the whole pregnancy? A pregnant client with a normal pre-pregnancy weight should aim to gain a total of about 25 to 35 pounds throughout the entire pregnancy. When calculating GTPAL, do twins count as one in both the preterm and term categories? Yes, when calculating GTPAL, twins are typically counted as a single pregnancy in both the preterm and term categories. Is isotretinoin safe to use during pregnancy? Isotretinoin is not safe during pregnancy. It is a medication used to treat severe acne but is highly teratogenic, causes birth defects. Pregnant individuals should enter a risk management plan and use 2 forms of birth control while taking this medication. Additionally, individuals taking isotretinoin should not donate blood while on this medication. What are the effects of magnesium toxicity, and how is it assessed? Magnesium toxicity can lead to central nervous system depression. The earliest sign of magnesium toxicity is absent or decreased deep tendon reflexes. Normal reflex is 2+, which should be assessed during magnesium infusion. If magnesium toxicity is not recognized early through deep tendon reflexes, what can it lead to? If magnesium toxicity is not recognized early, it can progress to respiratory depression and even cardiac arrest. What should be done if magnesium toxicity occurs, and what is its antidote? If magnesium toxicity occurs, the magnesium infusion should be stopped immediately. The antidote for magnesium toxicity is calcium gluconate. True or false, magnesium toxicity can also cause low urine output, less than 30 milliliters per hour. True, magnesium toxicity can lead to low urine output, which is a concerning sign. What is an amnio infusion, and for what condition is it typically used? Amnioinfusion is a transvaginal infusion of a crystalline fluid into the amniotic sac. It is often used to compensate for the loss of amniotic fluid in cases of oligohydramnios, low amniotic fluid volume. What do late decelerations indicate in pregnancy, and are they considered a good sign? Late decelerations in fetal heart rate indicate uteroplacental insufficiency, which is not considered a good sign as it suggests inadequate oxygenation of the fetus. How are late decelerations corrected in pregnancy? To correct late decelerations, interventions may include administering oxygen, repositioning the patient on their right or left side, discontinuing oxytocin if it's being used, and providing an intravenous fluid bolus. What is mastitis, and what are its symptoms and treatment? Mastitis is a postpartum breast infection caused by clogged milk ducts and poor breastfeeding latch. Symptoms include fever, breast pain, breast inflammation, and redness. Treatment typically involves antibiotics and ibuprofen for pain relief. It's important to ensure proper drainage of the breast, often through direct breastfeeding, with the infant's mouth covering most of the areola. Wearing soft cup bras can also encourage milk flow. What are the characteristics of fetal alcohol syndrome, FAS, and what complications can it lead to? Fetal alcohol syndrome, FAS, is characterized by microcephaly, small head, short eyelids, palpebral fissure, a flat midface with underdeveloped cheekbones, a smooth philtrum, the groove between the nose and upper lip, and a thin upper lip. FAS can lead to intellectual disabilities and developmental delays in affected individuals. What risk is associated with advanced age during pregnancy? Advanced maternal age is associated with an increased risk of Down syndrome, a genetic disorder. What complications can result from smoking during pregnancy? Smoking during pregnancy can lead to perinatal loss, sudden infant death syndrome, SIDS, low birth weight, and premature birth. Why should Depakote not be taken during pregnancy, and what birth defect is it linked to? Depakote should not be taken during pregnancy as it is associated with an increased risk of spina bifida, a neural tube defect. True or false, recovery and hospital stay after a cesarean section, C-section, are typically longer compared to a vaginal birth. It is important to watch out for VBAC, vaginal birth after C-section, because previous scarring may make tearing more likely. True, recovery after a C-section often takes longer, and hospital stays may be extended. It is important to be cautious with VBAC because the presence of prior uterine scarring can increase the risk of uterine rupture. What are variable decelerations in fetal heart rate, and what typically causes them? Variable decelerations are abrupt, short-term decreases in the fetal heart rate. They often occur due to the compression of the umbilical cord. This compression can temporarily reduce the oxygen flow to the baby, causing these decelerations. What are early decelerations in fetal heart rate, and what is their common cause? Early decelerations are typically caused by head compression during contractions. They tend to closely mirror the contractions themselves and are considered a normal response in most cases. What are late decelerations in fetal heart rate, and what do they often indicate? Late decelerations occur later in the contraction cycle and often signal a potential problem. They can be a sign of decreased oxygen supply to the baby and may be associated with issues such as placental insufficiency or maternal hypertension. They require close monitoring and prompt medical attention.